Here's a little challenge. Can you guess which of these signs is a sign of pancreatitis? I'm going to give you the answer to this question in this video. But first, here are 6 signs of pancreatitis that you would never guess are signs of pancreatitis. Number 1, abdominal bloating. Patients with pancreatitis can present with just bloating of the stomach. No vomiting, no nausea, no other signs, just plain bloating. And this can pose a challenge. The bloating can occur because of the buildup of gases in the bowel. Just imagine someone blowing up a balloon, except that in this case, the balloon is blown up but it doesn't burst. It just sits there in the abdomen, causing the abdomen to protrude. The second symptom is hiccups, and I've seen this one with my own 2 eyes in the emergency room in New York City. A patient presented to the emergency room one evening with a history of 2 days of hiccups, incessant. Of course, he was very, very worried because he did not have any such symptoms ever in the past. No abdominal pain, no nausea or vomiting, just plain hiccups. Fortunately for him, the blood test showed that he had pancreatitis, giving the diagnosis away. The third sign is shortness of breath. Patients can present to the emergency room or to their doctor's offices with shortness of breath and not know that that is a sign of pancreatitis. Just imagine you're a doctor working in the emergency room and a patient appears at the emergency room complaining of not being able to breathe. The first thing you'll do is examine their lungs and you find that that's normal. Then you do a chest x-ray and that is normal. Then you check the oxygen levels in their blood and that's normal. Well, you've hit a roadblock. The fourth sign of pancreatitis is what is known as Cullen Sign, which is a bright colored discoloration, a bruise that appears on the abdominal wall around the navel. This is the result of fluid from behind the pancreas working its way into the walls of the abdomen. It's like the wick in a lamp, sucking the fuel from the lamp up the wick to the tip where it is burned. Imagine a target overlaid on the stomach with the navel at the center, the bullseye of the target, except that in this case, the target is of bright colors such as green or yellow or purple. This brings us to the next sign, number 5, Gray Turner sign, which is similar to the previous sign, but is different in that the discoloration appears in the flanks at the sides. Now, this too is a result of bloody fluid working its way into the layers of the abdominal wall. It's like molten lava working its way into the crevices among the rocks. And both of these signs are signs of severe pancreatitis. These 2 signs are like a red flag waving at the doctor, telling them that the pancreas is literally dissolving, melting like a cube of ice. Patients with these signs are often admitted to the ICU for treatment of their pancreatitis because it's so severe. Sign number 6, racing of the heart. This is the answer to the question at the beginning of this video. Patients with pancreatitis sometimes present with racing of the heart. The heart is racing like a thoroughbred at Belmont Park. In situations such as that, if there are no other symptoms typical of pancreatitis, such as abdominal pain or nausea or vomiting, the diagnosis can be very challenging. Presentations such as this can be a typical trip up for a doctor. The problem is when patients present with simply racing of the heart, a lot of time is wasted examining the heart. If you want to learn more about pancreatitis, take a look at this video here. I'll see you in the next video.